Today we are going to look on what it takes to be a nurse. My question is, do you have the qualities that can make you a good nurse? Here are some of them. And before we state them, or I give you some of the examples, let us understand what it means by the term nursing, or the nursing that you want to give out. Nursing is one of the most rewarding and fulfilling careers out there for those who are interested in pursuing work in the healthy care field. Nurses have the training and unique skills set to be able to deliver high quality care to a wide variety of patients, while making a direct difference in their clinical outcomes. However, a nursing career can be demanding as well. Nurses, particularly ones who are just beginning their careers, and this I mean the nursing students, or those who have or who are giving the nursing services in various sectors or various levels, often work long hours and have grueling schedules. In addition, they have to be adaptable and ready to whatever comes their way. For these reasons, it takes a special type of person to be a successful nurse. And I mean a successful nurse because you're going to give a successful care. If you are interested in nursing career, it is important to understand the job requirements or the requirements of your career, as well as the traits that will help you along the way. This, I mean, those features, those characteristics that will make you remain a good nurse in your life. And here are some of the characteristics. 1. Excellent communication skills. For you as a nurse, you need to be able to communicate well. It's one of the most important skills set to have. They have frequently worked directly with both patients and other medical professions, which makes speaking and listening critical, both in terms of understanding patient needs and physical care plans. Underline, which makes speaking and listening critical, meaning they have to go in hand. It doesn't mean that you speak without listening. For you to have excellent communication skills, you must have a virtue of listening. Speak, listen what your patient is saying, listen to what they are speaking about, and after all, attend to their needs. Empathy. Remember to differentiate between empathy and sympathy. Now, for you to be a good nurse, you must have empathy. Nurses should be empathetic towards their patients, providing comfort and explaining complicated medical terms when necessary. The hospital experience is often difficult for patients, and nurses serve the role of early as well as care provider. You need to be a friend. Be a friend to your patients. You need to be a good friend. Yeah. Develop that friendship. A good caring nurse must have empathy, must have good relationship between them and their patients, and therefore give them a good care. And this I mean nursing care, because you are a nurse. Detail oriented. Detail oriented. Nurses should pay close attention to the nuances of patient care. The smallest details can have far-reaching consequences when it comes to your patient's health. So being able to take in a large amount of information and act on it is one of the characteristics of a great nurse. Detail oriented. For instance, your patient is moving on bed severely. He looks so agitated. And for you as a nurse, you go ahead, sometimes restraining your patient because you think your patient, the GCS has some confusion, the GCS is low. But the patient has something else. The problem is somewhere. The patient saying, oh, I feel my abdomen has a problem. You have to assess your patient carefully. Maybe the patient has not going has not opened the bowels for so long and has some constipation. Now he feels that urge, and then after all, when you find that your patient has passed stool, the patient becomes comfortable, he is even now able to sleep. So let us keep to details of what our patients' problems are, and therefore we are going to be good nurses. Next, creative thinking and problem solving. Creative thinking and problem solving. For you to solve problem of our patients, you must have a critical thinking. Nurses frequently find themselves in surprising situations, especially in emergency or trauma care. They have a short time to make care decisions that can be life or death. So being able to think creatively and make the right decision quickly is important. Successful nurses are always prepared to the unexpected. I like it. They are always prepared for the unexpected. Therefore, you out there, you want to become a nurse, my friend, my brother, my sister. For you to be a good nurse, here are the characteristics. Let us summarize them. Excellent communication skills, empathy, detailed orientation, creative thinking, and problem solving. So, once you have the 4 characteristics, there are more others, but once you have the 4, I think they can make you to be a good nurse or become a good nurse. Now that we have understood this, assess yourself. See if you fit into these characteristics. Then you know what? If I have made it, what can prevent you from becoming a good nurse? Join me. Let us join hands and let us advocate for good nursing.